So we had reviewed, and we'll do this again in class, we've done it in the past, but just to show you, this is the pelvic floor assessment and treatment. You know, this is lateral recumbent, left lateral recumbent. Why left lateral recumbent? To take pressure off, right? If you're going to do it, this is a nice place to do it. Basically go cephalad, cephalad, and lateral. Cephalad and lateral. That's what the arrows are trying to show you. The thumb is marking what landmark? Ischial tuberosity, so you need to know how to find that. Midway up the hamstring, go straight cephalad. You should run right into the ischial tuberosity. And then for the inferior part, thumb marks it. You go just a fingered breast medial to the ischial tuberosity, and then you put pressure and you go down. To remind you again of what musculature are we influencing, we're marking here, we're putting pressure here, and we're working our way towards the coccyx. So it's this portion, the musculature of this portion, right?
Yep.
This portion of the pelvic floor. From a lumbosacral compression or decompression or assessment, we can do it lateral recumbent again. Now in this case, the person is lying on the right side, albeit briefly, just so, you know, for demonstration purposes, I was doing it this way. But you can check lumbosacral movement here. How do they breathe in and out? You can enhance or augment that normal kind of nutation, counter-nutation movement that should be occurring with respiration. You can give a separatory force here to decompress some of the lumbar lordosis that's occurring or compressing. You can carry it up and decompress up into the thoracic region, or you can clue in where you want the person to contract or relax, so you can do muscle energy from this position as well. So it's, again, it's being creative, trying to figure out how can I treat this particular person with this particular set of mechanical issues going on in a way that's going to help alleviate, at this point, you're dealing with palliation, palliate some of their ongoing issues. This is, you know, lateral recumbent. Again, I just showed it right lateral recumbent because that's the way we were shooting the pictures. But here, you know, blocking at the knee, using sustained pressure there, that can be inhibitory, or it could be myofascial release approaches, how you can use the lateral recumbent kind of rolling kind of positions. You can open things up, you can work on side bending, you can work on rotation, you can move on up into the thoracic region, you can open up and move the scapula, right? We've learned all the different ways of going through lateral recumbent, how to assess the scapula, move up through the scapula. Okay? You know, long lever, short lever, how we want to use things, whether we want to counter lever, pushing in here, pulling up here. Again, anything you can do to alleviate some of that tension, alleviate some of that discomfort, balance out some of the autonomic imbalance that's occurring because of some of the mechanical strain patterns, you know, you're going to be their hero. They're going to love that. You can work the cervical region to some extent from here, anchoring here, a little bit of flexion, rotation, side bending, whatever you need to do. Again, whatever you do with a pregnant woman, your major goal should be to improve their level of comfort.